What is good, YouTube? Hey, it's Jay, and I'm back again today with another video. Now, this video is very short. It does appear on the TMC exam, but not very much. The other reason I am doing this video is because it is called incentive spirometry, and it helped COVID-19 patients with lung exercises tremendously. So I wanted to put this video out. We're gonna go over a few things for the TMC exam. However, if you are a COVID-19 survivor and if you still have an issue with fluid buildup or lung strength, I suggest that you watch this video, and I have a demonstration video coming up showing you how to use the incentive spirometry. Okay, if you're taking the TMC exam, there are 1 or 2 questions on the exam, but a point is a point, and we'll show you how to get through those in just a moment. Without any further ado, let's go. Okay, guys, as always, I'm working from the left to the right on the board. And like I just said, the incentive spirometry or sustained maximal inspiration or SMI, you could see either one of those listed on the test. They're all the same, but they'll call them something different just to throw you off. 1 or 2 questions on the test, let's cover those, and then we want to talk to those who may have COVID-19. For the TMC exam, okay, the incentive spirometry is used for pre and post surgery patient. Now, for pre-surgery patient, we're just getting a baseline as to how much volume that they can actually blow. Now, post surgery, we're trying to get them back to their baseline because now after surgery, it hurt for them to take a deep breath. And on this exam, if you have a surgery patient of any kind, always look for incentive spirometry to appear somewhere on the exam. Okay, the patient is coached to perform to their inspiratory capacity. You need to make sure you know that. They'll throw that in on the test just to make sure you're paying attention. Now, we call it incentive spirometry, but the incentive spirometry is actually the equipment. The actual therapy is sustained maximal inhalation or inspiration, and they will call it SMI on the exam. Just definition, little terms, and little things that you should know. Like I said, 1 or 2 questions on the test, but you want every point. Now, how this works is if a patient pre-surgery, we'll get a volume on the patient. Let's say the patient blew 1,200 milliliters prior to surgery. Well, after surgery, we will set that goal 1/2 of that 1,200, which would be 600. So they'll have the new goal would be to blow 600, not the 1,200. Okay, that's very important for the information for the TMC exam. Now, if they can't do the 1/2, we lower the value to something they can obtain. We want them to attain a goal, okay, after surgery to prevent any post-op pulmonary problem, okay? But as we work with them, even if they don't do the 1/2, just make sure they are doing the procedure in order to help eliminate any fluids that may be in their lung and to prevent those pulmonary problem or post-op pulmonary problem. And we'll talk about those right now. Atelectasis, pneumonia, any fluid that may build up in the patient lung, and they can also use it for just lung strength. Now, remember that these procedures are done on conscious patient, okay? If they need lung expander type of therapy and unconscious, then we'll use IPPB, okay? Now, this procedure consists of the patient, of course, sitting up, head elevated. The patient start with a passive exhalation where they'll just let out their breath passively or to their tidal volume, let all the tidal volume out, and then they will take in a slow, deep breath. And when they do that, it will move the marker on the incentive spirometry up to the preset indicator. And at the top of that breath, they should take a 3 to 5 second breath hold and then let the air out passively or until the marker fall back down to the bottom of the equipment. Okay, this is recommended to be done 10 times every hour, and the patient should be resting. The patient can rest between the maneuver or the procedure, because sometimes if they try to do it too fast, they will have lightheadedness or dizziness, and we don't want them to do that. We don't want to overwork them as well. We want to make sure that they take a deep breath and that they can cough, okay, to keep their lungs clear. If you are a COVID-19 survivor, okay, or if someone told you had COVID-19 lungs, the incentive spirometry is a great tool for you for breathing exercises, okay? COVID-19 attacks your lung, but you have to fight back. Do not know or experience this disease and not rehabilitate yourself. You can still get fluid buildup in your lung or inflammation. All right. COVID patients should use this therapy for rehab. Do it as many times a day or night as you possibly can, so that you will not end back up into hospital with some type of pneumonia or adolescence, and at worst, having COVID-19 again. This is something, listen, what I'm telling you as a COVID patient is this is just like someone being involved in a motor vehicle accident, okay? If someone get hurt in a motorcycle or a motor vehicle accident, their physician probably will send them to a physical therapist. Well, in this pandemic with COVID-19, we recommend that you take respiratory therapy, and your respiratory therapy is the incentive spirometry. Use it. Exercise and rehab your lung. I can't say that enough for you. If you've had COVID-19, if you're having a problem with COVID-19 in your lung, fluid will build up. You can get pneumonia. You can get atelectasis. You need this machine to help you strengthen your lung volume. Okay? So there you have it. Incentive spirometry. Not only for the TMC exam, but also for my COVID-19 survivor. And good luck to you out there. Okay, guys, and there you have it. There are only a few questions, mainly what we talked about on the board on the TMC exam. More importantly, I want to talk to the COVID-19 patient. You can get this from any DME company or do a medical supply company, or just ask your physician for a prescription. Hey, guys, listen, I really need your subscription. Do me a favor. Hit that like button, subscribe to my channel, turn on the post notification bell, because I'm doing 1 and 2 videos every single week concerning respiratory therapy essential for the TMC exam. And until next time, we out.